you have another bill, 1150. And if you'd like to bring up Cindy Eckert, Brian Rogoff, that would be fine.
Thank you very much, Mr. Chairman and members of the committee. Bringing to you an issue that deals directly with the public safety and health of school students. Specifically, Senate Bill 1150 requires that the State Department of Education, in consultation with the Department of Health and Mental Hygiene, develop and monitor the implementation of computer safety and health guidelines and procedures to be implemented in every county. SB 1150 also requires each county to implement the computer health and safety guidelines and procedures. There have been a number of growing concerns raised about the use of computers and electronic devices amongst children. With me today, I have Cindy Eckert, is a constituent of mine who has researched this issue extensively, has written several letters to the editors in major newspapers speaking about some of the issues that she has seen in with her children as a result of the use of screens within the school system. Also, I have, I'm sorry, I lost my notes, Dr. Rogoff, who is a specialist that has looked at some of the technical issues of this as well. I encourage you to read a number of the letters of testimony that are here in your package that identify some of the issues that people are seeing on a day-to-day basis. And I also want to just note at the DHMH's letter of information that in the last paragraph they do acknowledge that MSDE and the department do not currently have guideline recommendations for the use of computers in school and the potential health risks. So I believe that this is a very real issue, and again, a lot of the symptoms that we're seeing are coming on recently. This gives us an opportunity to take a look at what those symptoms are, what the usage of computers is amongst the children in our school system, and hopefully come up with a comprehensive way that we can look at that and guidelines for use. So I appreciate the opportunity to be here. Thanks.
Good afternoon. I'm Cindy Eckert. I appreciate the lateness of the hour, and we've all been here for a while doing the state's business. I wanted to let you know that I do a lot of homework. I do my research very well, and I had the chance to review your biographies online. And I just want to say thank you. In this room, collectively, is a group of people who have served their community beautifully and have taken care of the children of this state for a long time. And I just want to say thank you and to say hello to Senator Young, with whom I worked many, many years ago. I've read, like I said, I've read your biographies. You are the voice of the advocates and of the disenfranchised who have no voice to protect themselves. Today, the students of Maryland are the ones with no voice. They need your protection. They need you to pass Senate Bill 1150. Right now, as Senator Hershey said, there are absolutely no safety guidelines in place to protect children from the health hazards caused by using computers every day at school. Although every educational initiative calls for more computers, no one is paying any attention to the well-documented and well-known health risks these devices pose, especially to growing children. SB 1150 corrects that situation. It requires the schools to work with the Department of Health and Mental Hygiene to create safety guidelines and to monitor their implementation. What are the health risks? There are too many to name in 3 minutes effectively, but according to OSHA's documentation, which goes back 20 years, people who use computers every day suffer from fatigue and headaches, as well as neck and shoulder pain, dry eyes, and blurred vision. The symptoms are actually worse for children because their young eyes can't protect themselves from the screen's damaging blue light. It goes straight to the back of a child's eye, increasing the risk for macular degeneration and potentially blindness. I'd like to just stop on that one word for a moment, that some of the things that our children are facing every day increasingly could blind them. That's why Prevent Blindness America and the National Center for Children's Vision and Eye Health have endorsed Senate Bill 1150. These national experts in children's vision recognize the real danger that Maryland students are now facing. They're asking you to take a stand and protect this generation of children. Working on computers for hours every day also increases the chance that our children will develop myopia, permanent nearsightedness. The University of Southern California has just completed the largest study ever conducted on this visual impairment. USC reports that the number of children who are suffering from myopia has more than doubled in the last 50 years, and the researchers know why: screen time. Given all the medical complexities and the emerging data, in addition to what's been known for years, it's clear that we need doctors to help protect our kids. Superintendents are not physicians. The Department of Health and Mental Hygiene is needed to help craft these guidelines because this is a children's health issue. I hope you will speak up now for those who can't defend themselves. SB 1150 is simple, enabling legislation with bipartisan support that won't cost anything. Our children are owed a safe learning environment. Please make sure that students are both tech-savvy and tech-safe. In addition, I had the opportunity to sit in on a conference call. The Children's Environmental Health and Protection Advisory Council met this morning, and I have been speaking with Dr. Mitchell, the chair, and they will be sending you a letter suggesting that the setup of guidelines is necessary. They had a beautiful presentation this morning from a Johns Hopkins doctor, and I'm sure they'll be sharing that information with you. Thank you. I'll be happy to answer any questions.
Rogoff?
Yes, thank you for the members of the committee for listening to my testimony here. My name is Dr. Brian Rogoff. I'm a healthcare consultant as well as a Maryland licensed optometrist, and very passionate about this particular legislation. And definitely feel that by requiring the state of Maryland, through interagency collaboration, develop computer health and safety guidelines in the public school system, it's not only to protect the children's vision, but further state safety, healthcare reform goals. Now, this is also very much in line with CPAC as well as the SHIP program to reduce childhood obesity. And a lot of the things that Ms. Eckert has stated are some of the things that I've been looking into over the years. And I also have an 11-year-old son who I take precautionary measures because we do not have the guidelines in place. Just want to let you know some of the health hazards that have been associated with the prolonged use of computers. As Ms. Eckert has stated, increased nearsightedness or myopia. Now, a lot of that time could be corrected with glasses, but we're seeing much more of an epidemic. In 2009, there has been a 66% increase in this, and some other countries are calling this an epidemic. There are many, many studies going on in China that are they're seeing this as well, and they're doing very focused studies on how to reduce myopia. Because the greatest health concern is the increase of severe myopia, which would increase the risk for serious eye problems like retinal detachment, glaucoma, and macular degeneration. In addition to this, some of the things that Ms. Eckert also had pointed out is the posture and the fatigue, and this is known as computer vision syndrome. And just some things that have been pointed out, sitting hours in front of a computer screen stresses the child's eyes, because a computer forces a child's vision system to focus and strain a lot more than any other task, so that's different than books, and can put the children at even greater risk than adults for developing symptoms of computer vision syndrome. On top of that, there's a lot of studies that have been going on with blue light, and this is something that I actually speak at different type of continuing education meetings. And one thing I do want to point out is that blue light is something that there's a lot of controversy over, that there's good and there's bad. As humans, we've always been exposed to this through the sunlight, but now that we're being exposed to after those hours really does mess with our systems. And we do receive these systems through the eyes. And artificial light sources emitting this blue light are compact fluorescent lamps, LEDs, and they're found in almost every digital device, including tablets, computers, and smartphones. And there's also mounting medical evidence that prolonged exposure to this blue light may permanently damage the eyes, contributing to the formation of cataracts and destruction of cells in the retina, causing macular degeneration. on top of other sleep studies as well. So thank you for your time.
Seeing none, that concludes the hearing. Thank you for your patience and your testimony. Thank you very much. We will now move to